Well, Australia and Victoria have both hit the magic 70% double dose target, unlocking new freedoms. But freedom comes with a warning. GPs sounding the alarm over the long-term impacts of COVID. Joining us now is President of the Royal Australian College of GPs, Dr. Karen Price. Doctor, nice to see you this morning. Just talk me through your concerns here.
Well, the concerns are with a long-time pandemic like this, as we ease the restrictions, we are going to see more COVID in the community. I'm so pleased to see Australians stepping up and getting vaccinated, because that means they're going to stay out of hospital. But we're still going to have a lot of COVID in the community, and GPs need resourcing and help to support the community in their homes, managing hopefully mild COVID. We've also got the parallel issues of a long tail of mental health concerns and chronic health disease. So we're managing a lot all at once in the community.
Well, that's it, isn't it? A lot has fallen on our GPs during the pandemic. I mean, how much additional pressure has that put on doctors and, in fact, the entire network?
Well, I'm so proud of my colleagues. They've stepped up again and again for their communities. We are, as doctors, really tied into our communities. We really care about our patients, and we've adapted again and again. But it has been tiring, and of course you've seen the stories of abuse. So sometimes people taking out their frustrations on our front desk staff and that, which has created a bit of a toll. So we're still here, we're still going, and we're looking forward to, of course, like everybody, opening up. But we know that's going to bring new levels of change for us to manage patients in the community with COVID, and also to hopefully see our patients again for their long-term health conditions.
And what do you think that looks like when Australia opens up, and not just interstate and in cities, but when we actually open up to the world?
Look, I think it's going to be a very challenging time. I do have faith in our public health leaders. They've kept us pretty well, considering I know it's been challenging, but we really have done pretty well, Australia. And like I said, we'll do even better the more and more people get vaccinated. That's what I'm really focusing on, encouraging people to get vaccinated, because that will really help us as we open up to the world. That's the way to protect ourselves.
So when you say you need extra support, and I think there's been a lot of focus on what our hospitals need and what's coming in that regard, but when you say you need additional support, as a GP, what does that look like?
That means we want to be able to spend longer time with our patients, and particularly those with mental health concerns. GPs are well trained in dealing with the mental health spectrum that we see, and we can assist people in not going into more higher levels of care by getting to them early. And that includes also for chronic health conditions like diabetes and cancer screenings. So we really need to be able to spend more time with our patients, and we're looking for Medicare resourcing to reflect the changing demographics.
Well, you just touched on there, you've mentioned a few times now actually, mental health, and I know this latest Health of the Nation reports actually says that mental health is now the most commonly reported reason for a patient to see their GP. I mean, that's pretty scary stuff. It's almost like GPs, you're doing that role, but you've become a counsellor too.
Yeah, we are seeing a lot, increasing amounts of mental health distress throughout this pandemic, and we expect that will go on after the pandemic. So we are wanting to spend longer with the patients and really get to the bottom of what their concerns are and manage them appropriately. And that means, you know, mental health doesn't always just occur on its own. We often have people presenting with mental health, but with also other long-term health conditions. So
why can't you spend this additional time with the patients?
Because the Medicare benefits schedule tends to reward shorter, higher volume care, and that was probably appropriate for the, decades ago when it first started. But now we need to have an investment into chronic, complex health care.
And is anyone listening to that message?
We've had some good discussions, and now we want to see the outcomes of those discussions. So we're looking forward to hopefully a revitalisation of general practice for sure.
Yeah. Well, look, can I just say, I mean, GPs. The job that you've done over the past 19 months is just extraordinary, and always do. We thank you for that, and we appreciate your time this morning. Thanks, Doctor.